I'm here with Dr. Keith Smith of the Surgery Center for Oklahoma, who is investigating Bitcoin, and he's actually considering his payment for his practice. Dr. Keith Smith, you're looking into Bitcoin. What is it that has attracted you to the digital currency?
Well, it's more stable, and even though it's a fiat currency, it's not subject to the political winds of the Federal Reserve and the spendthrift habits of Congress. I'm reading actively, trying to understand it. I know the economist Gary North considers it a Ponzi scheme, and I read most of what he writes. But there's a raging debate on one of my favorite websites, probably my favorite website, LouRockwell.com. And there are other libertarian, anarcho-capitalist guys that are writing and saying, no, it's anything but a Ponzi scheme. It's actually a new alternative to currency. Jim Epstein at Reason Magazine is a fan of Bitcoin and has a relative who's an expert. And I'm actively investigating it and very intrigued by it and inclined to embrace that as a method of payment for patients here.
So you find it to be a true viable alternative to the Federal Reserve note?
I am reserving judgment until I read more, because I'm a doctor and I don't pretend to be as knowledgeable about currencies as Ron Paul. So I've got a lot more studying to do. But my default position typically is that if anybody in the government recommends it, it's probably bad. And that the current Federal Reserve Chairman of the United States government has been out of shape over Bitcoin is a bit of an advertisement for me. So I'm intrigued with it.
All right, Dr. Keith Smith, we look forward to hearing your final decision on whether or not you decide to use Bitcoin.
Yeah, I think if a patient offered to pay me Bitcoin, it would probably push my hand. I probably would decide to do it, but that's not come up yet.
Well, I'm sure the market will make that decision for you, it sounds.
That's right.
All right. Well, we hope to hear from you soon when you make that decision.
Thank you.